Okay, please help yourself to the buffet. All right, so good morning, everyone. My name is Michel Kazatchkine. I'm a member of the Global Commission on Drug Policy, and it's my pleasure to welcome you this morning to this third Inter-Ministerial Dialogue, co-organized by the World Health Organization and the Global Commission on Drug Policy. So let me just start by saying a few words about the Global Commission. I know a number of you are familiar with the Commission. We're currently 27 members of the Global Commission from all parts of the world, and we came together united by a recognition of the inadequacies of the current drug control approach. And in the red document that is on your tables, we summarized 5 pathways for action that was drafted 6-7 years ago, but it's still fully valid for the Global Commission. And these 5 pathways to improve drug policies are as follows. Number 1, prioritize people's health and safety. Drug policies should focus on safeguarding health as a fundamental human right, promoting prevention, harm reduction, and treatment. Second, ensure access to essential medicines. Over 80% of the world's population doesn't have access to equitable access to controlled medicines for pain, and governments have to remove the barriers that prevent access to, let's say, methadone or opioids for pain. 3, end the criminalization and end incarceration of people who use drugs. Criminalization harms individuals and communities. We advocate for the decriminalization of drug possession and use, and for the abolition of the death penalty for drug-related offenses. 4, refocus law enforcement responses to drug trafficking and organized crime, rather than focusing, as it happens now, on low-level elements of the drug trade. And finally, and this is the most contentious, of course, of our advocacy proposals, progressively end prohibition and move to legal regulation of all substances to put governments back in control of the system, regulating drug markets to reduce the harms of prohibition, and using controlled regulation for substances that are currently illegal. So that's the background for the Global Commission. We are having an ongoing dialogue with WHO, and I'm very pleased to see a number of colleagues from WHO here today, and I would like to thank them for their efforts and for the excellent collaboration we're having. In 2022, when we met with Dr. Tedros, at that time, we decided with Dr. Tedros that we would jointly create a space for dialogue on drug policy and practice within the frame of the World Health Assembly. And since then, we had 2 of these dialogues in 2023 about access to safe use of essential medicines under control, and last year, 2024, on harm reduction. So today is our 3rd dialogue, and it is focusing on the UN common position. Let me give you the entire name of that position: United Nations System Common Position supporting the implementation of the international drug control policy through effective interagency collaboration. This UN common position was endorsed by the CEB, the UN System Chief Executive Board for Coordination, under the leadership of the Secretary General 7 years ago now, to guide the UN system approach to drug policy and explore how countries can work with stakeholders and partners to enact drug policies that align with the principles outlined in that common position. And we will be hearing from partners today, how is this moving forward and how is this being implemented and where are the challenges in implementation. Just a few words of logistics here. Please kindly note that this event is being recorded. We also have online participation, and I welcome, of course, those joining us online. And if you do wish to ask a question while you're online, please use the chat. We can pick up your contributions and questions, and they can come to us here in the room. And for those in the room, please help yourselves to the buffet and enjoy the morning. So let me now introduce our first speaker of the morning, my fellow commissioner of the Global Commission on Drug Policy, and actually the chair of our Global Commission, the Right Honorable Helen Clark. Helen.
Good morning, everyone, and thank you for making the early start to come and discuss these issues with us. Michel has set out the purpose of today's event, which is the third in a series of three, agreed with the WHO for 3 consecutive World Health Assemblies. I'm very pleased to make the third because actually I haven't been to the World Health Assembly since I was New Zealand Minister of Health in 1989 and 1990, and quite a lot has changed in between, obviously. But can I thank WHO for its partnership with these series of briefings. Also thank all diplomatic representatives, excellencies who've come this morning, other UN colleagues and people from civil society as well. Michel set out well the goals of our commission, and if I put it in a sentence, it's prohibition has failed and there are other ways, based on evidence of what works and grounded in health and human rights principles. And that's what we have been campaigning on now for rather more than a decade. And not, I might say, without seeing some forward movement of consideration of a broader and more humane approach to drug policy. And just to note that from the Commission for Narcotic Drugs held in Vienna in March, there was agreement very much promoted by Colombia, which has been very forward-leaning on these issues under President Petrov and previous presidents also. There will be a high-level panel set up which will review the architecture around the UN drug conventions. And again, we have hopes that when the light of evidence, transparency is shone on this, that we may also see some improvements in the architecture. But this is long, slow work, as any of us who've been involved in the multilateral process know so well. So to come precisely to introduce today's event, which is to familiarize people more with the UN system common position on drug-related matters. Don't ask me what the acronym is. We don't want to know. But suffice to say that back in 2018, Secretary General Antonio Guterres led the Chief Executives Board, which he chairs, of the UN system to adopt this common position. And of course, the Secretary General comes to this with enormous credibility because he was Prime Minister in Portugal when Portugal adopted a world-leading approach to harm reduction and to keeping people alive, regardless of the substance they were using. The Portuguese model, if I could put it that way, has been much studied Others have followed to varying degrees, but the Secretary-General speaks with personal knowledge and passion on these issues. So he brought the 31 entities in the UN system together around the common position. And after I speak, the chair of the task team that was set up for the common position, Justice Tettey from UN Office of Drugs and Crime, will be speaking. The task team, its job is to work to get collaboration among the agencies, particularly on the ground in country, which is where reform is driven from, and to familiarize countries with the common position and how to benefit from the knowledge across the UN system on it. The common position, as you would expect from one driven by the Secretary-General, was centered on developing and implementing policies, priorities, rebalancing drug policies and interventions towards public health approaches, increasing investment in harm reduction, ensuring equal access to public services for people who use drugs, and advocating for alternatives to criminal conviction, including decriminalisation of possession for personal use. Now, as you can imagine, a position like this will always face challenges in being rolled out, but we work on the basis that the more countries are familiarised with it, the more hope there is that elements of this approach at least will be picked up. I should also note that there are the international guidelines on human rights and drug policy published in 2019 by a group of agencies, which included my old agency, UNDP, the Office of the High Commissioner for Human Rights, which has been a tremendous ally in this quest for better drug policies, WHO, UNAIDS, and the International Centre on Human Rights and Drug Policy. And those guidelines, I understand, have been drawn on in a number of countries very interested in reform, not only Colombia, but also Brazil, Ghana, and then Scotland, which has been very forward-leaning because it carries the burden of having the highest number of drug-related deaths in all of Western Europe. So the government of Scotland is very focused on these issues. So with those words of introduction, I shall hand back to our MC and hope you find the session this morning informative, and we'll have ideas to take back to Capital. Thank you, Michel. Thank you.
Thank you, Helen, and welcome back to the World Health Assembly. Our next speaker will be, as Helen said, Justice Tettey. He's the Chief of the Drugs, Laboratory and Scientific Services branch at UNODC. And most importantly for today's discussion, he's the head of the UN system task team that coordinates the implementation of the UN system common position. Justice.
Excellencies, ladies and gentlemen. It's a great pleasure to address the dialogue on the UN System Common Position, which serves as an important tool guiding UN interagency collaboration adopted in 2018 by the United Nations System Chief Executives Board for coordination. Colleagues, interagency collaboration well predates the common position. However, the common position reflects a shared recognition within the UN system that whilst our agencies bring different mandates and expertise, our efforts to support member states in addressing the world drug problem must be coherent, balanced, and grounded in science, evidence, human rights, and sustainable development. Currently, the common position does not aim to create new policies. Its purpose has always been to bring the UN system together to speak with one voice while providing support to member states and ensuring that the UN assistance is not fragmented, but comprehensive and coordinated. To turn this vision into practice, the Common Position established a UN System Coordination Task Team. Led by the United Nations Office on Drugs and Crime, the task team brings together 10 UN entities working collectively to strengthen coherence and collaboration across the system. Ms. Clark mentioned 31 at the start. Here again, you see one of the challenges. 31 were called, 10 showed up. The UN task team meets quarterly, but maintains continuous collaboration well beyond those meetings, particularly at country level. And over time, we've learned two important lessons from our collective engagement in addressing the world drug problem. First, the challenge is diverse. It cuts across all three UN founding pillars, impacting peace and security, human rights, and development opportunities alike. Second, partial responses simply do not work. Fragmented or isolated measures focusing on only one aspect whilst neglecting others often fail to deliver sustainable results. And in some instances, they even cause additional harm. With that in mind, the UN System Common Position commits to a truly balanced, comprehensive, integrated, evidence-based, and human rights-based approach to addressing the world drug problem. An area where this approach is increasingly being challenged is a rapidly evolving synthetic drug crisis, which perhaps represents the most complex and pressing global threat we face. It's driving violence, instability, and severe public health consequences across many regions. While this was not mentioned in the Common Position, effective responses to synthetic drugs require science, expertise, and cooperation. In this regard, and in addition to our long-standing partnership with UN entities, members of the task team, UNODC has intensified collaboration with other UN and non-UN entities and partners whose expertise is essential in responding effectively and comprehensively. And these partners include UNICEF, Interpol, the International Civil Aviation Organization, and IOM, amongst others. Excellencies, colleagues, allow me to highlight some concrete examples of how our interagency collaboration has been delivering results. First, interagency cooperation on health remains very strong. The UNODC CHAMPS initiative, aimed at building resilience among children to prevent drug use, now includes the World Health Organization, UNFPA, UN Habitat, and UNICEF, with rollouts underway in several countries. Partnerships have also expanded in areas such as treatment of drug use disorders, overdose management, HIV prevention and care, and support in humanitarian settings and in prisons. Second, the UNODC synthetic drug strategy now engages 23 UN partner programs. The strategy offers a balanced and comprehensive framework grounded in science and built on international cooperation, early warning systems, science-informed health responses, and strengthening counter-narcotics capacity. Third, our passenger and container control program has expanded collaboration to counter trafficking by sea, land, and air, while preventing the illicit supply across borders. These partnerships help ensure the function of illicit trade, making sure that narcotic drugs and psychotropic substances reach patients who need them for medical purposes. Now remember, this is a founding principle of our current international public law framework on drugs, and we need to uphold this. Finally, alternative development remains a vital area of joint action. UNODC works closely with UN Women, UNOPS, ILO, UNHCR, and UNIDO to support people affected by the world drug problem in achieving alternative and sustainable livelihoods. And looking ahead, the UN task team is also working on a joint UN system report, which will reflect the lessons learned and evidence acquired over the past decade by the United Nations. And we hope this is going to guide and support member states in facing today's and tomorrow's drug-related challenges. Ladies and gentlemen, in closing, to meet today's complex and rapidly evolving drug landscape, we must speak as one and continue working together with renewed urgency across sectors and across borders and across the entire United Nations system. UNODC remains fully committed to supporting all member states to deliver on the promise of drug policies that are balanced, evidence-based, grounded in science, and the core values of the United Nations. I thank you.
Thank you, Justice. We'll now have a video message from Mandeep Dhaliwal, who is the head of the health unit at UNDP. And then we will listen to a number of countries with the question of, is this common position being implemented on the ground? So could I ask for Mandeep's video, please?
Excellencies, colleagues, and friends, it's a pleasure to be here with you today. Many thanks to the Global Commission on Drug Policy and WHO for convening us to discuss advancing drug policy reform grounded in health, human rights, and sustainable development. UNDP is a proud member of the United Nations System Task Team on the Common Position on Drug Policy, which is coordinated by UNODC. We work with countries and partners to implement our shared UN commitment for balanced, evidence, and rights-based drug policy. UNDP led the development of the international guidelines on human rights and drug policy, together with UNAIDS, WHO, OHCHR, and the University of Essex. The guidelines have become a widely recognized and referenced tool for policy reform across developing and developed countries. The guidelines are inspiring change around the world. In Colombia, they have informed a bold new national drug policy. In Brazil, they are contributing to intersectional reforms that confront the legacies of racism, over-incarceration, homelessness, and exclusion. In Albania, the guidelines underpin judicial sensitization to avoid punitive responses to minor drug offenses. In Pakistan, they have helped shape reform proposals, including the removal of the death penalty for drug-related offenses. In Ghana, the shift from imprisonment to fines for personal possession has been a critical step forward. And in Côte d'Ivoire, we're seeing a redefinition of drug use from a punitive issue to a public health concern. This is what change looks like when human rights, health, and development norms guide national drug policy. There is much more to do and no time to lose. We are now more than halfway to 2030, and we're operating in a deeply complex, challenging, and often polarized context. We still have to deliver on the promise of the SDGs, especially for some of the most marginalized and vulnerable. Ultimately, we need to act faster and more decisively on this issue and many others. Drug policy is not just about health or criminal law. It intersects directly with multiple development goals: poverty, hunger, gender, sustainable cities, access to justice, environmental sustainability, and other priorities. We cannot end AIDS as a public health threat by 2030 or deliver on the promise of universal health coverage or reduce inequalities if millions of people are excluded due to stigma, criminalization, or lack of access to essential services. Excellencies and colleagues, we have the right tools. The Common Position provides a shared UN vision. The international guidelines give us concrete operational tools for the implementation of the Common Position, which are consistent with international human rights and drug policy conventions. What we need now is more strategic, faster, and more coordinated action. Let's work together across the UN, countries, and communities to address the intersections between drug policy and human rights, health, and development. To help us deliver on the SDGs and fulfill the pledge to leave no one behind, please be assured that UNDP remains deeply committed to this shared vision. I wish you all a very productive dialogue. Thank you.
Thank you, Mandeep, for that message. And let us now move to an important section of this dialogue and hear from countries. And it's my pleasure and honor to call now Ambassador Álvaro Ayala Meléndez, Deputy Head of Mission, Permanent Mission of Colombia to the United Nations in Geneva. Thank you, Ambassador.
Good morning, Commissioner Helen, Chair of the Global Commission, Mr. Michael Kazatchkine, Commissioner of Commission and distinguished keynote speakers, representatives of Portugal, Scotland, UNODC, UNDP, WHO, distinguished delegates and representatives of the civil society. Let me begin by expressing my gratitude for inviting me to share with you the vision of Colombia on this important conversation. The punitive global drug control regime has a negative impact on human rights, and in the case of Colombia, has been a key factor in the armed conflict. It has been an obstacle to peace. The 2016 peace agreement between the government of Colombia and the FARC-EP, in its chapter 4 refers to the problem of illicit drugs. The final report of the Colombian Truth Commission identified drug trafficking as one of the major obstacles to peace. This is why President Gustavo Petro government has a new approach, one that places human rights at the center of our national policy on drugs. In 2023, Colombia adopted this new policy, and the role of the UN supporting us in the designed UNDP and in the implementation now of this new policy is key, is important, and we really appreciate it. We have more than, no, at the moment we have 24 agencies of the UN system present in Colombia. The new policy reinforces the primary healthcare system by deploying basic health teams to rural and remote areas. It improves access to health services, allows early detection of drug-related problems, expands mental health care, and promotes prevention. 98 projects addressing psychoactive substances are in place. 9 are focused on harm risk reduction. Over 52,000 persons have used the services of the harm and risk reduction program. Harm reduction is now an essential part of the new drug policy in Colombia. Now I would like to refer to what we have achieved working with other countries and civil society at the UN level. At the Human Rights Council, the special procedure, with the special procedures and with the Office of the High Commissioner for Human Rights. All then have an important role in guiding the UN system and member states to implement human rights perspectives regarding drug policies. A core group of like-minded countries that includes Colombia has promoted 3 council resolutions related to drug policies and human rights, one in 2015, other in 2018, and the last one, 2023, has been the most ambitious to date. It includes reference to harm reduction, what was unthinkable some years ago, and called for a report by the High Commissioner of Human Rights. In this report, the High Commissioner refers to the negative impact of the punitive focus of policies on drugs on human rights, and makes some important recommendations to states and to different actors. Regarding the special procedures, I want to highlight the reports prepared by the Group of Arbitrary Detention and by the Special Rapporteur on Right to Health. Colombia, regarding the rights of indigenous peoples and peasants, we have to say that Colombia considers that the inclusion of the coca leaf in the list 1 of the 1961 Convention lacks of solid scientific evidence. While tobacco kills 1 million people per year, we don't know of anyone who has died from chewing coca leaves or drinking coca tea. Colombia supports Bolivia requests for the reclassification of the coca leaf process, and we know, and we are we also support the work is being done at the WHO. At this moment, a group of experts is reviewing this matter, and they will produce a report that we will have to present to the WHO. We are living an historic moment in the drug policy at global level. In 2024, in Vienna, at the Commission on Narcotic Drugs, CND, Colombia supported resolution 67/4 that recognized harm reduction as a component of a public health approach. And last March 2025, I was mentioned by Madam Claire, one very ambitious step was taken at the CND. Colombia, in partnership with over 60 delegations, presented a resolution that calls for the establishment of a high-level panel of 19 independent experts to prepare a critical review of the global drug control system. The World Health Organization will have to appoint one of these experts. The resolution has adopted with just 3 votes against. We are facing a one-in-a-generation opportunity to review and to rethink 6 decades of the so-called war on drugs. Excellencies, distinguished members of the floor, the role of the UN system supporting the effort to have drug policies with a human rights perspective is essential. The guidelines on drug policies and human rights are an example. In Colombia, these guidelines have been an important input and have been quoted in several rulings of the Constitutional Court. The UN system common position has a critical role, and it can play an advancing evidence-based, more human and more effective drug policies. Agencies such as WHO, UNODC, UNIH, UNDP, UN Women, and the Office of the High Commissioner for Human Rights have done significant contributions. We welcome the High Commissioners for Human Rights presence and participation at the 2024 CND session, and we believe that the heads of other UN agencies should also engage directly and participate in dialogues with the CND. Lastly, let me this kind of dialogue could contribute to a more transparent and more fluent communication among agencies, and to have a better approach to human rights in Vienna. A more fluid and responsive interaction between states, the coordination with the task team of the UN Common Position and other stakeholders is essential to ensure that the common position commitments are translated into concrete action. Thank you.
Thank you very much, Ambassador, and congratulations to Colombia for hosting a very successful harm reduction conference a few weeks ago. We'll now hear from Portugal, and it's my pleasure to introduce Francisco Pavão, Director for International Relations at the Ministry of Health in Portugal.
So, good morning, Excellencies, distinguished colleagues, ladies and gentlemen. Portugal is honored to contribute to this interministerial dialogue and welcomes the opportunity to share our national experience and reaffirm our commitment to drug policies grounded in public health, human rights, and sustainable development. We fully support the United Nations Common Position on Drug Policy and international guidelines on human rights and drug policy, which call for balanced, evidence-based, and people-centered approaches that place dignity, well-being, and inclusion at the core of our collective response. In the late 90s, Portugal was facing a severe drug crisis with some of the highest rates on heroin use and HIV infections in Europe. Drug-related mortality was rising, and prison overcrowding reflected the dominant punitive approach. In response, in 2001, Portugal shifted from a punitive model to a comprehensive public health strategy. The core of this change was the decriminalization of drug possession for personal use, while maintaining criminal sanctions for trafficking and supply. This was not legalization. It was a recognition that drug is a health issue, not a moral failing or a criminal act. Portugal's drug policy rests on mostly 4 key pillars: dissuasion commissions, non-criminal administrative bodies that assess individual drug cases and connect people with health and social services appropriate, harm reduction, including needle and syringe exchange programs, opioid substitution therapy, supervised consumption rooms, and drug checking services. Accessible treatment and reintegration services focused on recovery, autonomy, and dignity. And prevention, delivered through education and community engagement, often led by civil society organizations. This model shifted the perception of people who use drugs from offenders to individuals recovering or deserving care and support. Over 2 decades of implementation, the impact has been significant. HIV infections among people who use drugs dropped from 60% to 13% of all new cases. Drug-related deaths fell from 350 in 1998 to 81 back in 2021. Incarceration rates of drug-related offenses declined by over 50%, and public health services reached more people earlier with better outcomes. We believe that this humanistic and pragmatic model was proven to be both effective and sustainable, and it is inspired reforms and a dialogue at international level. But we remain fully aware of emergent threats. We are facing now a growing threat from synthetic opioids like fentanyl and new psychotic substances, particularly among young people. And these substances are often more potent and more difficult to detect and regulate. Portugal responded by adopting also specific legislation back in 2013 to control these new psychoactive substances and integrating these into our national drug law. However, the digital market, regional disparities, and low perception of risk pose new challenges that requires new adaptation. Dear colleagues, Portugal's experience shows that decriminalization combined with investment and health, harm reduction, and reintegration can work. But drug policies must be inclusive. A sustainable and just approach requires the active participation of civil society, young people, people who use drugs, professionals, and researchers. Policy is more effective when it is co-created with those directly affected. Portugal continues to support UN common position and advocates for the alternatives to punishment in appropriate cases, universal health coverage that include drug user disorders, the reduction of stigma and discrimination, and a whole of society approach aligned with drug policies within the 2030 Agenda for Sustainable Development. The challenges we face, from overdose crisis to synthetic drug proliferation, demand coordinated, multilateral, and science-based action. Portugal calls on member states and UN agencies to seize the moment and reinforce commitments in upcoming forums, the Commission on Narcotic Drugs, the High-Level Political Forum, and UN General Assembly. Let's work together to ensure health, dignity, and inclusion remain at the center of global drug policy. Portugal remains fully engaged with this shared endeavor, and thank you all for this. Thank you.
Thank you very much, and thank you for reminding us how health is at the center of drug policy in Portugal. It's my pleasure now to call on Neil Gray. Is he here from Scotland? Oh, is he on video? I'm sorry, I didn't realize that. Okay. Neil Gray is the Cabinet Secretary for Health and Social Care, and he will address us with a video message from Scotland.
I would like to start by expressing my thanks to the World Health Organization and the Global Commission on Drugs Policy for inviting me to be a part of this World Health Assembly Inter-Ministerial Dialogue. It is an honour to be asked to contribute to your discussions today and to have our work in Scotland on a public health approach and on the Charter of Rights for people affected by substance use recognised in this international platform. I'm only sorry I'm unable to attend in person, but I look forward to hearing about your discussions and learning from the experiences of other states who are also taking a rights-based perspective to support people affected by substance use. The Scottish Government has made an important commitment to ensure lived and living experience and equalities and human rights are at the heart of everything we do. Key to this has been supporting the National Collaborative to develop a Charter of Rights for people affected by substance use, with the aim of integrating human rights into drug and alcohol policy to support Scotland in taking forward our commitment to improving and saving lives. The Charter of Rights was co-designed by a change team of people with life experience through extensive consultation with people affected by substance use and with people responsible for design, delivery and monitoring of substance-related support services. The Charter outlines 7 key rights from both national and international law, drawing on the international guidelines on human rights and drug policy, and describes how these rights practically apply to people affected by substance use and how people can effectively claim these rights. For example, the right to the highest attainable standard of physical and mental health is essential for everyone, but it can be difficult for people to claim. We need to make rights real in all places and spaces for all people. The Charter supports people affected by substance use to be empowered to demand that their rights be upheld and that the barriers they are all too often face are removed. And it supports duty bearers, including government, to adapt their services to reflect the Charter's provisions. Connecting with and building relationships with people is key. We want to meet people where they are and support them in the ways that they need, which is why harm reduction services are so vital. This is why we have recently opened the United Kingdom's first safer drug consumption facility in Glasgow, and influenced by the Charter, it has been designed by the people who will be using it. Our successful work on the medication-assisted treatment standards that are intended to improve access and service delivery to people in the need of treatment and support for opioid substitution therapy are also being improved by applying a human rights-based approach to their implementation. Also, police officers in Scotland use their discretion to address minor offences through a recorded warning, including when they encounter someone in the possession of any type of drug. Scotland is also the first country to have its police force implement force-wide carriage of naloxone. Everyone deserves healthcare and support delivered in a way that reflects their right to be treated with dignity and respect. By building services that accommodate individual needs and which acknowledge and respond sensitively to the trauma they may have suffered, we hope to offer people affected by substance use and their families a safe place from which they can regain the agency they need to live fulfilling lives. This is not one size fits all. It may look different in
any way we can, let's, I'm sorry for this, but I think we got most of the message from Neil Gray with the news of the opening of the safe consumption room just a few weeks ago. We'll now open the floor and open the discussion. Please raise your hand or placard or anything so to draw my attention, and let's have a discussion. Yes, Graham?
Thank you very much indeed, Michel. Excellencies, ladies and gentlemen.
Please introduce yourself,
Yeah,
Graham.
I'm
Sorry.
Graham Alabaster. I'm the head of UN Habitat's office here in Geneva. Of course, thank you very much to WHO and the Global Commission for inviting us today. And our interest, of course, in supporting this work, along with the common position of drugs, basically comes from our work over the past 30 years on safer cities and establishing the elements of safer cities and future urban design to improve the quality of life. Our partnership, of course, is very, very important because we see the work of the Global Commission and UNODC and others as essential to build secure and safe urban societies. We come at this from two perspectives. One, from the point of view as the organization in the UN who supports local authority and city governments to improve their effectiveness, and then also through our long-established partnership with WHO on a variety of health aspects, including non-communicable diseases and other areas. In our new strategic plan, which is due to be launched by our governing body, in fact, next week, our big focus is now on housing and basic services. And of course, the work of drugs and how we improve the quality of life and housing is, of course, very, very important. So this will be a key activity of our new strategic plan going forward. And indeed, earlier this year, when my chief executive, Anna Claudia Rosbach, met with Dr. Tedros, this was very clear that we wanted to support this area of work. One immediate activity that we will undertake with WHO is a revision of the housing and health guidelines, which will now be expanded to include many of these other areas which are critical to ensure people have safe and healthy lives. I think that as we move forward, and I'm going to repeat some statistics here, you all know that by 2050, nearly 70% of the world is going to live in urban settings. But maybe what some of you don't know is that of all the urban space that will exist in 2050, 60% of it has yet to be built. So we have this huge opportunity now to influence the way cities expand. Urbanization is exacerbated now because of migration due to conflict and climate. So we need to ensure that urbanization proceeds in an efficient and manner. And of course, ensuring that communities are safe, housing and urban communities are built is very important. And this is where the work of the Global Commission and WHO are very important. We signed an MOU with the Global Commission back in November last year at our World Urban Forum. And we've got some clear deliverables coming up for the next 2 years to support your work. So thank you very much for the partnership with you and, of course, with our colleagues in WHO and the rest of you. And we look forward to continuing the work in the future. Thank you.
Thank you, Graham. It's for us to thank you also for excellent work with you. And I guess most of us if not all of us in the room have realized in the last few years how much city and city work can be an important port of entry to actually work on drug policies at the local level. We also realized, we heard from Neil Gray about Glasgow, how much a city can take an initiative by itself. This happened in the US with the opening of some safe consumption rooms there, somehow independently of the heavy bureaucracy at state or even federal level. So thank you very much for that intervention and your work. Anton Besenko is the executive director of Input, the international network of people using drugs. Anton.
Thank you, Michel. Thanks a lot, and hello, everyone. Chair, Excellencies, colleagues, thank you for having us here, and thank you for the floor. Well, I speak today not only as the executive director of the International Network of People Who Use Drugs, but also as a person who has used drugs since the age of 14 and who has lived with HIV for many years. Well, I waited years for treatment, survived overdoses, and buried close friends, all due not to drugs themselves, but to the deadly consequences of stigma, criminalization, and underfunded services. This is a really pivotal moment. At the UN Commission on Narcotic Drugs earlier this year, we saw cracks in the foundations of punitive drug policy in countries from all regions, particularly the Global South, and my special respect to leadership of Colombia, called for a shift. They called for rights-based, health-centered responses. They called for an end to the war on drugs. We have a unique opportunity to make this shift real, but good intentions are not enough. What we need now is action, and what we need is truth. And the truth is this: most people who use drugs still face criminal punishment instead of care. Harm reduction remains grossly underfunded. Community-led services, like the ones that saved my life, are being defunded and sidelined. Input's recent report, The Human Cost of Policy Shift, which you can see on your screens, document how foreign aid cuts are already gutting harm reduction programs. Across Eastern Europe, Central Asia, and Sub-Saharan Africa, these cuts are leaving thousands without access to life-saving services. These are not abstract budget lines. They are people. People like me, people like those I've lost. Unfortunately, one of the key findings is that the first disrupted service is peer work and outreach model, which is the founding element of the harm reduction model. What means that if you remove this element, in fact, you stop the provision of all other harm reduction services. Among other disrupted services, we can see HIV testing, human rights and legal support, services for women who use drugs, opioid agonist therapy, overdose prevention, etc. As a result, we see increase of stigma discrimination, people are back to the street use and dying from overdose again. And now, to make matters even worse, the Global Fund's recent reprioritization process can exclude dedicated support for people who use drugs even more. Despite overwhelming evidence of need, despite the global aid strategy's focus on key populations, the reprioritization plan fails to safeguard funding for harm reduction and community-led responses. This is not just a technical oversight. It is a political decision with life and death consequences. We cannot claim to promote health-based responses while we continue to criminalize, marginalize, and exclude the very communities most affected. So, can you imagine how extraordinarily important now is uniting forces of all UN agencies, communities, and civil society? Can you imagine how important is UN common position on drug policy and how much community of people who use drugs relies on our collaboration and outcomes? I think it's obvious and requires no comment. UN agencies often speak of collaboration with communities, but let me be clear. True collaboration is not just a seat at a table already set. It means co-design, co-decision, and co-leadership. It means investing directly in peer-led networks, and it means addressing the structural violence that underpins our exclusion: racism, colonialism, patriarchy, and classism. In Ukraine, where I'm from, people who use drugs have not only survived war and displacement, but have also built some of the most effective harm reduction responses in the world, often in spite of, not because of, policy frameworks. There's a saying we use: for us, survival is not resilience, it's resistance. And resistance demands more than technical support. It demands justice. So let's stop speaking about health-based responses in isolation. Let's talk about decriminalization. Let's talk about funding. Let's talk about power. Only then can we truly catalyze action. Thank you.
Thank you very much, Anton. Can you just keep the microphone, and since you somehow alluded to it, you've worked for a long time in Ukraine, and we've known each other for a long time from that period when you were there. Could you elaborate a bit on, as an activist and as a patient in Ukraine, what was your relationship with how did you see the UN agencies work on the ground? In silos, coming together on the issue of drugs, strong, weak? That's the topic of today. Don't be diplomatic, as Annette says. I mean, we need to hear from you. We need to hear the good things, and we need to hear the weaker things.
Well, to be honest, of course, especially because I start working from the ground root level. So it's not like from the very beginning of my activism career, I became working on the international level. I started as a peer worker in one of the organizations in Kiev. Then we organized our national networks, first network of opioid agonist therapy patients in Ukraine, which then later turned in the first Ukrainian network of people who use drugs. So, of course, we were really on the front line of the help to our peers, to the people, and at the same time, of course, we were trying to use our activism and motives and capacities in the advocacy in collaboration with UN agencies. Well, what I can say first, our first impression was always that it's always like more tokenistic approach than the real help. Too much diplomacy, too difficult. So like people listen to you with a smile, like they totally understand what is your life problems, and they kind of like trying to help, like you think, but in fact we never saw really strategic things. I do understand that, well, sometimes, you know, this capacity of country offices is limited. It can be one person or two persons. But even one or two person, what we know from our activism, even few people like really motivated, and it's not about money always, right? It's just, you know, if you have these empathies, you have these motives, or it's a part of your daily job, you can do a lot. And so it's not a matter of, you know, how big is your country office. But let's be honest as well, the dynamic finally turned to a positive. I think many things came with the war and full-scale invasion, with COVID as well. I think many things were really reconsidered, as well as the partnership, and I think Ukraine is really one of the good examples of partnership between all the parties, like community, civil society, government, and UN agencies, which makes us a leader, at least on the region of Eastern Europe, Central Asia. So I do hope that these dynamics would keep going, but this is really a one country example. But if we go like wider, I know from my peers, from my position as director of international network of people who use drugs, I think we're still concerned about even pure human contact between our activists and UN agencies. Sometimes we don't even know who are that UN agencies who could be helpful for us. We just know the most obvious, like UNAIDS or UNODC, but we don't even know the names of other people sometimes. That's the reality.
Thank you very much, Anton. Thank you. Anyone else? Yes, please.
Yes, good morning. I'm Antonio Yanakis. I'm under International Association of Hospice and Palliative Care, but also under that delegation, I represent palliative care in humanitarian situations and humanitarian situations and emergencies, so PALCHASE. So this topic is very pertinent to our advocacy, especially when it comes to areas where there is conflict, as well as if there's a natural disaster. And this is one part which we have a bit of an issue, like as our colleague had mentioned in Ukraine, there seems to be access to narcotics in situations where there is conflict. But then in other parts of the world, legislation can be a barrier, because before there might be strict legislation to prevent narcotic delivery in these areas where usually they wouldn't be, but then there's no provision in the law for if there's a breakdown in law enforcement, especially in a natural disaster or in conflict, how do you access this? And we see this, for example, in Gaza, where many people just simply don't have access to pain relief and suffering because of the difficulty in getting narcotics into these areas. So I work in Malawi, which is in sub-Saharan Africa, and the narcotic uptake for our patients is extremely low, partly because of the stigma against narcotics, as well as just simply not enough research in order to back up when we want to implement the use of it. So the point I'm trying to make is, when it comes to policy, where there needs to be a form of flexibility for when a situation changes, such as in humanitarian situations, as well as there needs to be a lot of emphasis on research, about cultural research, about the stigma that might be there against narcotic use or other substances where it could be of much value, but because of the current cultural stigma, there might not be much uptake of it. And with that research, we can back up to say, this is how we can use it more effectively. Thank you.
Thank you. Thank you for that important comment. And access to controlled medicines under all circumstances, including humanitarian emergencies, of course, is a key priority for the Global Commission and for WHO, all of us working here. Thank you for drawing our attention. Maybe Dilkushi, would you like to add a comment? I know on Friday you will be releasing the guidelines on access to controlled medicines. And are these points addressed in the guidelines?
Yes, after I think a 6-year development process, WHO is launching its guideline on access to controlled medicines, which will include how to access controlled medicines in emergency and humanitarian settings. We will be launching the recommendations this Friday at a lunchtime seminar. It's an official WHA side event at 12:30 in the Palais, and everyone is welcome to join. And we'll be releasing all of the recommendations that came out of this very complex process. Because as was mentioned, I think during many of the interventions, there are many barriers in accessing controlled medicines, including both legislative barriers as well as social, cultural, educational barriers. And the recommendations that will be published this week will kind of touch on all of those aspects. So we do welcome everyone to join and to support us in the coming months as we launch the full guideline.
Thank you. Omar? We'll now hear from Mexico.
Thank you very much, Professor Kazatchkine, and thank you to the Global Commission for organizing and for inviting me as well to this event. We heard about UN system collaboration during this morning. This is, well, I didn't say I work for the Permanent Mission of Mexico here in Geneva. I'm a human rights delegate, mostly at the Human Rights Council. It's where I work, and well, this is a forum in which, from the perspective of Mexico, it is relevant and it's an opportunity to promote the collaboration of the human rights bodies with those related to the traditional drug policy bodies, mostly those located in Vienna, the CND and the UNODC and so on. So this is what we were working. Colombia, earlier in their intervention, they referred to the 3 Human Rights Council resolutions that have been adopted throughout a number of years. And in those resolutions, in which Mexico has had the opportunity to be part of the core group of promoting countries, of sponsoring countries, we have pushed for these connections between Vienna, Geneva, and, well, when we asked in the resolution in 2023 to the High Commissioner for Human Rights to produce a report, there was also a request for the High Commissioner to go and present his report to the CND in Vienna, for instance. And this is something that we try to do at the multilateral level. Also, beyond the Human Rights Council, Mexico also is the sponsor of the resolution, the so-called Omnibus Resolution, which is adopted in New York every 2 years, entitled Addressing and Countering the World Drug Problem Through a Comprehensive, Integrated, and Balanced Approach, in which we aim to address the 3 key pillars of the world drug problem, which is human rights, law enforcement, and public health. And also in the last iteration of that resolution, we also refer to the different roles of the relevant UN agencies, and also called for collaboration within the system. And also there were some reference, for instance, to the guidelines on drug policy and human rights. So this is what I wanted to contribute, and thank you very much for arranging this wonderful event.
Thank you, Omar, and thank you to Mexico for leading on this work at the Human Rights Council. Justice, I'm turning to you. We've heard a few times, and maybe turning also to you, Jérôme, from Jérôme Salomon, Assistant Director General, WHO. We've heard several times calls for more Geneva-Vienna coordination action. I remember a few years ago, actually, the Global Commission initiated a high-level dialogue between Vienna and Geneva, and we had the chair of the CND coming to Geneva and addressing the diplomatic missions here. WHO and UNODC, key agencies here, I think we heard 2 or 3 times this morning a call for more cohesive work here. Would you like to add something? And maybe, Jérôme, a quick comment as well.
Thank you very much, Michel. I've taken notes on that particular issue when the colleague from Input, Anton, spoke, right? Anton asked a very particular question, which was, who are the obvious agencies? Who do we tend to when you've got issues in the countries? And I think that divide, that artificial divide of Vienna and Geneva comes into play in that. Now, when you look at the way the UN sees the issues, there's peace and security, there's human rights, and there's development. No one side provides a solution, and I alluded to that in my presentation. Now, what we've been trying to do with the UN Common Position, and this comes from a directive from the CEB, is to let countries know what the UN can provide in its entirety without a divide, right? And over the past couple of years, since the CEB meeting in Nairobi, over 100 countries have benefited from these briefings to the UN country teams, subsequent to governments, projecting a single image of the United Nations. And we are also trying to promote this within the UN tax team as well. I know the international guidelines seems to be kind of a tense point between some organizations. And it's important to know why not everyone is jumping at it. Note, I'm not saying not everyone dislikes it, jumping at it. And the reason is, we believe that any response should have prevention. And it was good to hear the counterpart from Portugal talking about prevention, others talking about prevention as part of a model which works. We also believe that every model on human rights should pick up on what Michel, you mentioned, and the colleague from AHPC mentioned, access for medical and scientific purposes. These are two aspects where the international guidelines could offer more. And is that plus, which we're talking to with the Geneva community, can we have that plus on the guidelines, which then becomes a document every UN agency can embrace, because it will then be all-embracing and not segmented. So yes, we are aware of that artificial divide. There is no need for it. And the tax team is pushing actively to see the UN delivering as one, be it from Geneva, Vienna, or New York.
Thank you. Jérôme, would you like to? I wonder whether we could revitalize those sort of circumstances where Vienna and Geneva come together, as health is really coming and human rights, of course, here in Geneva, but these are coming together so closely and strongly.
Thank you, Michel. First of all, very aligned with my colleague. I think it's more a question of mindset, political will, and commitment. So it's not a question maybe of Vienna.
That's why we need to raise it.
Or New York. And I see that maybe more like a matrix, because we need also a very strong mobilization on the field. So having all actors, civil society, NGOs, key partners, working very well with the national governments and authorities, I think is very important. So I would really say it's not a question of being far away, because when people want to work together, they are very ready to do it. And there is one UN, but it's a very, very important public health and global problem. So having all UN aligned and all UN agencies committed to help all the countries worldwide and to help all the actors would be very important. So it's a question of will.
Thank you. Yes, there's one more intervention there. Then we have, I understand, one question in the chat, and then we'll have to move to the last speaker of the event.
Thank you very much.
Thank
My
you.
name is My name is Dr. Barbara Hasty, and please allow me to speak on behalf of my colleague, Ambassador Guylaine Diop, who was chair of the CND 2022, who actually took on as part of his mission during the chairmanship, the joint call to action. So the WHO, UNODC, INCB joint call to action on scaling up implementation on drug control policies. Ambassador Diop actually is, since he's retired, he's actually expending his full time continuing this momentum across Geneva, Vienna, WHO, UN, INCB, and we actually will be here on Wednesday for meetings, but also chairing a side event on this very topic. It's really highlighting the launch of the guidelines, as well as other components that highlight this need for greater integration, but also continuing this momentum and galvanizing the momentum going forward. So I just wanted to be.
Thank you very much. Thank you.
Thank you.
The question on the chat, Anna, to whom is that directed?
Alexi from the European Network of People Who Use Drugs would like to know, how will the Global Commission advocate for the continuation of life-saving peer-led services impacted by the diminishing resources all over the world, especially in the Global South?
Thank you. Helen, would you like to address that, or okay? Well, I can only say the Global Commission obviously is very concerned about what you, Anton, mentioned, the impact of the abrupt decrease in international funding, ODA, with the decisions of the US administration, but I must say also the announced decreases in ODA in many donor countries, including major European donors to the international system. The input, the message to input is you can count on us, the Global Commission, as doing our utmost in advocacy. We're talking to governments, we're writing op-eds, we're speaking publicly, the Commission. So our advocacy will move along with your advocacy. Let's, however, be realistic also. We will not come back to where we were before. And we all have to put our efforts together to co-design, as it has been said by many of you, a new approach that will certainly be country-led primarily, rather than top-down from the international system. And that new approach will have to select priorities. In times of reduced funding, one has to look at long-term priorities. And obviously to us at the Global Commission, for the health reasons, the human rights impact, the societal impact, the impact in cities and on the life of the citizens every day and the communities, the drug issue has to remain a high priority. So my short answer is, yes, we will be advocating. You can rely on us for that, for sure. With this, I would like to call on our last speaker to close our discussion, Jérôme Salomon, whom I mentioned already, Assistant Director General for Universal Health Coverage, Communicable and Non-Communicable Diseases at WHO. Jérôme.
Right Honorable Helen Clark, dear Professor Michel Kazatchkine, dear Michel, Your Excellency, Mr. Moulizi Nkosi, Excellencies, distinguished guests, ladies and gentlemen, dear colleagues, good morning. I would like to start by expressing my gratitude to the Right Honorable Helen Clark, Professor Michel Kazatchkine, and the Global Commission on Drug Policy for organizing today's important event. We appreciate the Commission's efforts towards an evidence-based and humane global drug policy that strongly prioritizes health outcomes. We have heard very strongly today from the speakers that the world drug problem is an important global public health problem, and that its roots, causes are multidimensional and multisectoral. Like you, this is why WHO strongly believes that it will only be addressed by working closely together across sectors and with all partners, including the UNODC, UNDP, civil society, and all of you here today. Our long-standing collaboration with agencies here stands testament to our belief in this approach, in line with the UNGAS 2016 recommendations, the UN Common Position, and the Sustainable Development Goals. In implementing its mandate and commitments, the WHO covers several interlinked areas: the prevention and management of drug use and drug use disorders, access to controlled medicines, harm reduction, and drug-related infectious diseases, including HIV, viral hepatitis, and tuberculosis, with a strong focus on human rights. WHO will continue to support member states in developing and implementing responses to the world drug problem that are balanced, comprehensive, integrated, evidence-based, rooted in human rights-based, development-oriented, and sustainable responses. Ladies and gentlemen, we are clear about the scale of the challenge before us. More than 500,000 people still die every year due to drug use, and 9 in 10 people with drug use disorders are not receiving evidence-based treatment. Important medicines like methadone and buprenorphine are not registered in nearly half of all countries, and when they are not covered by public insurance systems. Punitive laws and legislation that criminalize people who use drugs further challenge access to life-saving and evidence-based services. And recent disruptions of harm reduction and drug treatment services, including the treatment of opioid dependence, threaten to set back the fragile progress that has already been made. We are pleased to soon be releasing a policy brief on mitigating these disruptions. There is still much to be done, and together we can and must face this challenge. We must continue to our close collaboration to expand the evidence base. We must improve the coverage and quality of treatment, including HIV and viral hepatitis testing and treatment services. We must have balanced national policies to safely improve access to medicines under international control through the provision of essential health services, workforce training, and robust regulatory and procurement mechanisms. I am delighted to share with you that WHO is sharing recommendations from its soon-to-be-launched policy guidelines on this topic later this week to support member states on these efforts. We must also review punitive policies and work towards the decriminalization of drug use while increasing service coverage for people who use drugs and with drug use disorders. And we must measure progress. Our continued leadership and partnership are essential to achieve these goals. Let's move forward together with a public health-driven approach to drug policies, ensuring health for all. The world is counting on our success. Thank you.
Thank you very much, Jérôme. With this, we're almost on time. I would like to thank you all for being here. Thank you for the comments. We heard from the UN. Thank you, Justice. We heard from various UN agencies, WHO, UN Habitat, among others. UNAIDS was somehow in spirit with us in the room. We heard from you, Anton, and the community. We heard, most importantly, from countries. Thank you, Colombia, Portugal, Mexico, Scotland, for your testimonies. Thank you to all. I wish all a great WHA week here in Geneva. Thank you.